Calfactant surfactant is 21 amino acid peptide that has been designed to mimic surfactant protein B. It has a similar function as shown in vitro biophysical tests such as pulsating bubble surfactometer, as well as during in vivo studies done on various animal models such as fetal rabbit assay, monkey rhesus studies, and finally preterm lamb models. Synthetic surfactants are evolving nowadays. Calfactant surfactant is not the first synthetic surfactant that was available for neonatologists to treat respiratory distress syndrome. The first one was developed in the 90s and it was Exosurf. The difference between Exosurf and Calfactant surfactant was such that Exosurf didn't contain any protein or protein mimic product, peptide. We know from studies done in 80s and 90s that presence of protein in surfactant preparations as well as a natural surfactant plays an important role in maintaining physical function and lowering surface tension. So studies has shown, especially in vitro studies, that if surfactant does not contain any protein or peptide component in it, the lowering surface tension lasts relatively short. And especially on pulsating bubble surfactometer, when we have repetitive changes of the radius of alveoli, the function of lowering tension of such a surfactant without protein is disappearing. The reason for that is that surfactant protein B and C are responsible to maintain monolayer of phospholipids. When we exhale air from our alveoli, the radius of alveoli changes, it gets smaller. And we can imagine that surfactant as a layer on the wall of the alveoli start to fold because the radius is smaller. And if we don't have such a we don't have a presence of surfactant protein B and C, those folding surfactant just creates micelles, and we have less and less surfactant. That's why in time we are seeing the lack of effectiveness of surfactant. Yes, Calfactant surfactant was approved by Food and Drug Administration in the United States in March of 2012. Well, first of all, we have a big interest in developing synthetic surfactants. Historically, if we look at other products that went from animal origin to synthetic, we can find insulin, growth hormones, and even blood products. So inevitably, synthetic surfactants will be used in the future. We know now, especially in 2012, we had a couple of publications with synthetic products that are in very early development stage. We have so-called CHF surfactant that contain surfactant protein B and surfactant protein C mimic. We just get familiar with the preclinical animal work with that surfactant, and probably next studies will be continued to also prove if such a combination of surfactant B and C protein can be useful in the clinics. There is still ongoing work with recombinant surfactant protein C based product, so I think that that's a future to have synthetic surfactants. That's regarding the origin of the surfactant, but also we can expect revolution in the way surfactants are delivered. We have ensure technique, minimal invasive surfactant technique that are studied extensively because clinicians, respiratory therapists and doctors wants to give surfactant in less invasive way. Another way of giving non-invasive surfactants would be aerosolized form of those drugs.